We've all heard of the Mommy Makeover. Well, what is a Mommy Makeover? It's a combination usually of breast surgery and body surgery in women. And they've typically had children and they've had some damage to their abdomen and they've had some effects on their breasts as well. And they're thinking, if I'm going to go in and have some surgery, I may as well get both of them taken care of at the same time. This is a 28-year-old nurse and she had 2 children. You can see the extra loose skin that she has here. She also had breast sagging, which you can't see in the photograph. And this is 1 year after surgery. I've done an abdominoplasty, a tummy tuck, and I've done liposuction. You can see the difference in her thighs and her knees and her flank areas. And this is the same patient 5 years after surgery. You can see the scar is barely visible. It's very important when doing a tummy tuck to keep the scar as low as possible, because women, they don't like it because it's long, but it turns out if you keep it low and it's within the panty line or the bikini line, it's very well tolerated and they don't have a problem with the scar. And it's such a favorable trade-off for the tummy. Now, breast-wise, typically we're doing a lift and often a combination of a lift and implants. A lot of patients come in and they say, you know, doc, I'm pretty okay with my size, but I just want them lifted. You know, I've really had some sagging that's occurred. The problem is it's difficult to take your own breast tissue and lift it up and get it to fill out the upper poles of the breasts. Implants do a much better job of that. So it's much more common for me to do both. I'll use the implants to fill out the top part of the breast, and I use the lift to tighten the lower part. And I use what's called a vertical lift, which has a lot of advantages over the old anchor scar or inverted T scar. Now it turns out that the tummy tuck surgery usually is more uncomfortable. The breast surgery, not as much. And that's why we do them together, because patients don't have too much pain after the surgery. They notice their tummy. They don't tend to notice their breast pain quite as much. And they're always glad they did both together and have one surgery and one recovery period.